excellent under the majority of circumstances, and 76% is the majority, and that's a pretty strong majority. So 3/4 point something, so 3/4 of 65 and older. Now, the thing that makes that a little less true are those older people who live in poverty. And even though it ought to be obvious, let me just make sure that it's obvious by asking, I'm going to pick on a couple of people. Amy at Wellington, why might Grandma and Grandpa, because they live in poverty, why might their health be a little less good?
Not adequate health care, perhaps?
Well, there you go. I mean, it's easy peasy. That's why. That is exactly, I just thought of another answer. That's exactly the probably number one best answer. There is an additional, not better or worse, an additional answer I wonder if somebody could think about. So let's think about the fact that Grandma and Grandpa live in poverty, but they've got Medicaid, they've got, I don't know, family members who can take care of this or that doctor visit cost, but their health still may not be as good as somebody who's got private insurance as opposed to, say, Medicaid. What other possible reasons could they be less healthy? Yes, go ahead.
Nutrition?
There you go. So they've got private insurance, or they've got Medicaid, and, not private insurance. They've got Medicaid, or they've got family helping them out. So getting to the doctor is not the problem. Even the occasional hospital stay is not the problem. But they're not eating right. So there you go. Those are two very valid reasons. Moving on now. What are some of the chronic conditions and disabilities? So you see them listed there, and quite often, what Grandma and Grandpa will eventually die of is the last thing on the list. Not that they don't die of the other stuff, they can, but pneumonia is quite often the last illness of the fluid building up in the lungs. It's how both of my parents passed. It's actually the President Bush is once again in the hospital, or I don't know if he's been released again, but pneumonia. So it's just what often is the cause of dying. Like I said, of course, this other stuff can also be the reason. Okay, so what can Grandma and Grandpa do for him or herself? So their activities of daily living, known on charts as what is their ADL, if they can dress, bathe themselves, get around the house without problems, then their ADL is good. But that might be the case, but they might not be able to go shopping alone or to the doctor's office or other instrumental activities that their life will demand, or they might. Let's hope they can. But that's the stuff they need to do for themselves outside the home, is the instrumental activities, not as opposed to, but in addition, the functional activities. How is their ability to go up and down the stairs? Can they still walk alone? Do they need a cane? Do they need a walker? And if they need a cane or a walker, that's fine. Thank God that exists for their support. But if they can get around using those aids, wonderful. If they don't even need the aid, that's even better. And guess what? Sometimes Grandma and Grandpa can indeed get around within the home without the aid, but when they go out, they might carry that cane or walker with them because they can support themselves by touching a wall as they're walking or touching a piece of furniture as they're going from point A to B. And so how's their reaching? You know, can they still reach that higher cabinet up there by still being able to stand on their tiptoes that they've always done because they've always been shorter than they would, you know, like to be, but that's what they are. Lifting and carrying and so forth. Okay, so if they can do all three of those categories of things, you just be grateful for that. Lifestyle influences on your quality of health. So if your lifestyle includes physical activity and exercise, wonderful. I mean, I love it when I go out on the walking trail, seeing elderly people. They may not be moving that fast, but they're moving, and there you go. It really is a wonderful thing to behold. And healthy diet, once again, I keep harping on because it's not me, it's the book, but I would do it myself also. Harping on fruits and vegetables as should be the main portion of your diet. It's not that you should never ever have a mashed potato or a mac and cheese or a something that's carbed. That's okay in moderation. Even I'd say once a week, you know, maybe Sunday dinner or whatever might be a special day of eating, maybe with family over on Sunday. You know what I'm saying. So, but it should be even then in moderation. It shouldn't take up the majority of the plate with a teeny vegetable like when you're 4 years old and your parents are trying to get you to eat if you eat that, Johnny, just eat one, taste it. You don't know if you don't like it until you taste it. You know, if they, that's right, have to try it. So there you go. Regular health and dental exams. These days, this may not be as true as it was when I was in my childhood and teen years, but back then, people in this age range, at least more often than not, didn't go to the dentist. It just was, I mean, considered unnecessary. I could pull my own tooth, or, you know, they just had this old-fashioned way of looking at things, and that's the way it was in their day. And to go to the doctor for a wellness checkup, what's that? That's a waste of money, right? And so if something is severely wrong, especially in a male, they will tend to be taken rather than choose to go, you know. So that's right. You guys can't hear the chatty Cathys over here, but but they are in strong agreement with the fact that they can remember some of those old days that I'm talking about. They're not as old as I am, but they've heard of them. The old folks class, anyway. Mental problems in Grandma and Grandpa. So for most people, mental health improves with age. Now that's wonderful. In other words, this isn't the only thing you're going to discover today. This is the first thing you're going to discover that actually gets better with age. So there are some benefits to being a senior citizen, to being older. And mental health, meaning you're less likely to, for example, become anxious, as in clinically so, as in a diagnosis of generalized anxiety disorder or a diagnosis of clinical depression. There are various kinds of depression, but you're less likely to get a diagnosis like that. Why? I can rattle it off, but I won't. I'm going to ask anyone to push. No, I'm not. I'm going to stick with calling names. Autumn, Wellington, Autumn, because my Autumn here isn't here today. But anyway, Wellington, Autumn. Why might mental health be less likely to occur in older people? I mean mental illness. I don't mean mental health. Mental illness of some kind be less likely to occur. What do you think?
I don't know, maybe because their brains are more mature. They don't change as much as younger people.
Well, now you're getting very close, and therefore you're on point so far to the degree to which your answer is indeed a good one. The brain has, since they were 25 years old, been at its 100% development in terms of being the frontal lobe is the last to develop. So the frontal lobe has its completion of growth by the time you're 25. So that makes your answer hold water for sure. And then another thing that makes your answer hold water is the crystallized memory is really strong. But I'm looking for thoughts on why else is the older person less likely to get a mental illness diagnosis. Yeah, go ahead.
I believe that a lot of times it's because of the, like what we had discussed in a previous chapter, that as those in middle adulthood and their children start aging out of the home, that emergent reaction to life isn't there anymore. Your life is slightly slower paced, and so that old adage, stop and smell the roses, that's the kind of lifestyle you're living at this point.
Yeah.
So it enables you to have a fresher perspective,
right,
more easygoing.
Right. So I have so far received 2 valid answers, neither of which is what I'm still hoping to hear from someone. But yes, indeed, I'm not just, exaggerating. Your answers are indeed valid. So basically, Joy, in my way of putting her answer, is saying once the kids are out of the home, there's less mental stress. It's chill out time. It's relax. It's stop and smell the roses, and absolutely, what's not to love about that, because there is less likelihood of generalized anxiety, less likelihood of depression. And I'm just naming those 2. There could be other illnesses that could happen that are less likely to happen when you're older. But I'm going to try Zach. Zach, can you think of anything else that would cause mental health to be better in older age than younger?
Not that I can think of. I was really with Autumn and how the brain just been mature and stuff for a while.
Okay, not a problem. Thank you. How about you, Jeffrey? Any additional thought that you might have?
I guess just like when you're older, you just stop caring about all the little stuff. I don't think that older people care as much if they're they care if they're healthy, but they don't care if they got a 6-pack or if they're sexually attractive to other people or anything. So I feel like that's a lot of weight to people.
I'll take that first answer, I don't know about that second answer because I'll speak up for us old folks over here. Okay. Thank you. You are on the answer I was looking for, in addition to appreciating the other two I also received. So, the answer that was in my mind is that when you're older, you have certainly learned the valuable life lesson of not sweating the small stuff. Pick your battles. That, chill out thing, which sort of ties in somewhat with Joy's answer. So, very good, guys. So, some problems with older age. Now, it looks like I'm about to have to, say I just lied, but I didn't. So, it doesn't mean that what I just said about depression or generalized anxiety disorder, it's still a truth that I stated already, but you did not hear me say that when you are of older age, you won't get depressed. You won't get anxious. I didn't, say that. So there are some who do. And by the way, to express why some do, I'm going to have to jump to Monday's class right now. This upcoming Monday, that is, which we, will be looking at psychosocial development in late adulthood, where that will remind us that in that last stage of Erickson's development, it is the stage called ego integrity versus despair, and most older people will be on the ego integrity side of the resolution of the ego crisis in that period of time. But even though most will be on the ego integrity side, some will be on the despair side, so ergo, there is the depression. Because, thankfully, most older people are at peace with themselves, at peace with life, good to go, chilling out, but not all of them. So, dementia, we all know, is another aspect of aging. Again, yes. Oh, go ahead, Marty.
I would like to interject for older people, they bring in the element of spirituality. Also helps a lot of older people because they get in their spiritual thing, and it's all about God. It's all about the next life and the Lord, and that's an escapism from the present situation. Sometimes people be talking too much about that to me, and I say, "Wow, you might well check on out because you ain't even with this world now." But that's why I don't interject.
Well, thank you, Marty. And you guys have come to long ago discover during this semester that I am indeed a person of faith, but at the same time, I'm aware of the boundaries in some instances between academia and faith, and I think I do a pretty good job of recognizing and appreciating those boundaries, because even though I'm a person of faith, even though I'm an older age person, I'm aware that not everybody either is a person of faith, period, or they adhere to a different faith than I do, or they are in a journey where they're questioning exactly, is this something that holds water? Is it something that will help me in my growth in life? And I recognize and support that. And so, nonetheless, since you brought it up, indeed, many older people who are on the ego integrity side especially are, as you said, people of faith. And generally, the term people of faith is a reference to people of Christian faith. I don't believe, and I could easily be wrong, and I'm all open for correction if I am, but I don't believe, for example, that a Hindu would refer to him or herself as a person of faith. They would refer to themselves as a Hindu, or a Buddhist, or a Zoroastrian, or a Sikh, or, good grief, I could spend the rest of the class listing names of religions. So generally the term person of faith is a reference to the Christian faith. At any rate, to continue my effort at being fair, it's not necessarily true that people of faith don't therefore get depressed, because they do, but if they have faith, they are likely to recover from it quicker because they take the time to take their eyes off their problems, concerns, issues, and remember there is God. There is someone I can reach up and grab hold of, because He's reaching to grab hold of me. He's just waiting for me to reach up and grab that hand He's reaching down with all along. And the depression can be diminished and erased, if you will. So, yes, it was kind of funny, Marty, when you said, how, in my words, how they are so much people of faith that it's like, you might as well check out of here. It was what you said, and go on to, the next life. And, but yeah, I mean, it has validity, and scientific research is coming up with more and more evidence that faith/prayer is a valid means of coping with depression, with life issues. I was just yesterday at an all-day conference in Cleveland where that information by the presenter was acknowledged, that science used to say, prayer, no good, it's just okay if you want that as your crutch. But now it is showing through metric ways, measurement ways, that it does help, versus the other group in the experiment who said they didn't use it. Which group got healthy quicker? And it was the group that utilized prayer. So, but yeah, thank you for that. So, let's move on to dementia. Physiologically caused cognitive and behavioral decline. So, when a person's memory gets a little shaky and granddad is starting to tell you the same story he just told you 5 minutes ago, or ask the same question he just asked, it's because of a cognitive decline in the brain's ability to recall or retrieve. And we're going to get to say more about that somewhere in this set of PowerPoint pages. We'll soon get there. So anyway, it's a physiologically caused cognitive and behavioral decline. Why behavioral? Well, if they're forgetting extremely important, I shouldn't say extremely, it's important whether it's extremely or not extremely, it's still important. So when you discover that grandma put her shoe in the refrigerator, or put something in a weird place, the carton of milk in the oven, I mean, it's obvious that they're losing it a bit, right? So that's the behavioral part. So in other words, the behavioral part is the outward evidence of the inward malfunctioning. Okay? So, what are some causes of dementia? Alzheimer's disease, Parkinson's disease, multi-infarct dementia, which is breaking of blood vessels in the brain, which causes small strokes, many breaking blood vessels up there, causing small strokes. So the strokes can be so small that you don't necessarily realize that you, grandpa, you, grandma, you, the grandchild, you, the child, may not realize they had a stroke because it's minor. It didn't paralyze. It didn't affect their speech. So strokes can happen and do happen that are not major strokes, that are debilitating strokes. Okay. Symptoms of Alzheimer's. Certainly, obviously, you would know it impairs the memory. It deteriorates the language. Okay. First of all, let's back up to the memory impairment. The reason memory starts to go is because within the hippocampus, where working memory is stored, it becomes less efficient because the neurons are starting to atrophy. They don't disappear, they're still there, but they become atrophied, which basically means shriveled up, which basically means kind of dead, but still there. So, of course, that's going to mess with the memory. And the cerebral cortex, where long-term memory is stored, is also suffering the same atrophying of neurons, so that grandma and grandpa are not able to, so to speak, reach up there and automatically go into the file drawer and automatically know exactly where that memory file is and grab it out, to use metaphorical language. So the deterioration of language, the next point, has to do with the temporal lobe, its cerebral cortex, being diminished in its effectiveness for the same reason of the deterioration of the neurons, the atrophying of the neurons. Why the temporal lobe? Because temporal lobe is where the Broca's area, you may remember from intro psych, the Broca's area is located, and that's where speech is expressed. In the frontal lobe is Wernicke's area, where speech is comprehended, understood, but the utterance of it is in the temporal lobe. So the deterioration of language that they're talking about here is grandma's and grandpa's ability to say what they want to say. So that's mostly a Broca's area, temporal lobe, diminishment of ability. Looking at point 3, deficits in visual and spatial processing. Well, that is from the occipital lobe and the cerebral cortex covering the occipital lobe area. So the occipital lobe is where you see. You don't technically speaking, see with your eyes, you see with your brain. Your eyes are the mechanism through which the sight is distributed, or from which it is sent, or the occipital lobe is sending sight information to the eye mechanisms. So deficits in visual is because of that occipital lobe. Okay, spatial processing, the diminishing of the right hemisphere, because largely it's the right side of the brain where your spatial abilities lie for the most part. Okay, moving on to point 4. Repeating of questions. Well, they're repeating because their memory isn't working well enough anymore for them to remember that you already answered it, because of the atrophied neurons that are preventing a highly skilled memory operation to still be possible. So, moving on to everyday tasks that are unfinished or forgotten about. Once again, same old reason. They forget to brush their teeth. They forget to, whatever, take a shower, whatever. That's automatic when you're younger. It isn't automatic anymore because of the brain's diminished ability to be effective. Personality change. Well, at some point, you are no longer you, or you are less and less you. You're still you to the degree that you are still left, or still remains, based upon what your brain is still allowing you to be able to do. But because you're becoming less and less of the you that you used to be, your personality becomes more rigid. You become more, I don't like to use the word, but I will use it just to explain another way of saying rigid. You become more stubborn. But rigid is a better word, because it's not like grandma and grandpa are trying to be stubborn, hard to get along with. Their brain is the reason. The memory that they have left at that point is what they have left to operate with, and it just kind of narrows them. Egocentricity, meaning they start being more quirky. They start doing odd things that just isn't the way grandma used to be. But that's weird that she wants to do that now, whatever that is. I can't think of a necessarily good example off the top of my head. Moving on, irritability or anxiety. So, the rigidness kind of goes hand in hand with being irritable. But then being egocentric, I've got to do it this way. This is the only way to do this thing. Or I want to do it, this way that we look at as being egocentric. Of course, that goes hand in hand, not only with being cranky if it doesn't work that way or happen that way, or you try to keep them from doing whatever it is they're trying to do. They, of course, are going to get anxious because they need, quote unquote, need to do it that way nowadays, because that's their brain dictating that it be done that way. And if you don't let that happen, they, of course, are going to get nervous, anxious, bent out of shape, if you will. Lack of concentration, of course. They can't concentrate as much because of the same reasons of the brain not working as well, so that they can focus like they used to be able to focus. Continuing, yes, Marty.
Oh, before you move on, before we asked about this question, was Alzheimer's and dementia, over the last few decades, it had exploded into way more prevalent. Is that because of some environment, or it always has been with us, but it was hidden and not hidden from the vast majority of us all? What is the answer?
So appreciate your question, which quite coincides with questions you've asked of that nature about other things we've studied in the past weeks, and it's still a good question as regards this. So, it is because Alzheimer's as a name wasn't discovered until, I forget, but if I remember sort of correctly, it was less than 100 years ago, and by a gentleman whose name was, it sounds like a female name, but it was Alois, A-L-O-U-I-S-E, I think, or it was A-L-O-I-S-E, one of those, but his first name was that name, however it's pronounced, and his last name just happened to be Alzheimer. And he discovered these tangles in the brain, and thus is given the, proper credit for discovering the disease. Thus it has his name. Now, the one thing you said, hidden. No, not hidden, just not known. So when it got known, it started to be published. It started to be taught in colleges. It started to be, therefore, that's the reason grandma or granddad is this way. Before that, like I've answered some of your previous similar questions about other things, before that, discovery and, publishing, etc., what you did with grandma and grandpa was sit them in a back room somewhere, and then they got sent to what used to be called the old folks home. And, you did what you did back in the day based on what you knew. And the world, let me not say the world, I'll say the United States and other places, but the United States, as it is becoming more educated, we are able to name, put a label to, identify why grandma and grandpa are acting that way. And we are, as a family member, able to handle them more appropriately than putting them in a back room somewhere. And everything was hush-hush. You didn't talk about it. It was just the way it was. So, appreciate the question again. Alrighty. So, what causes Alzheimer's? Neurofibrillary tangles. What this really means, if you could see a picture of it, is the neurons normally in a healthy brain, you can even see the movement happening where the axons are moving fast toward one that's moving in it. They're moving in each other's direction, and then they hook up. It's like there's this attraction that's smooth and easy and as it was created to be. But in the aging brain, there is, rather than the smooth axon and tip of the axon connecting to an oncoming axon with its tip, the dendrites. I'm sorry, it's the dendrite. Well, it's the, okay, get it right, Professor. It's the one neuron's axons moving towards the dendrites of the next neuron to hook up. And when aging starts to affect the brain, that process is less efficient, and the dendrites get a little tangled up and hairy, and it's if I could show you a picture, it explains it so much better than I'm stabbing at, but suffice it to say that the tangling up, the twisted masses of dead neurons is what happens. And so that's one of the problems / reasons that bring on Alzheimer's, but yet other reasons also. So, amyloid plaques, they're really beta amyloid plaques. I don't know if your book throws in the word beta, but the entire wording should be beta amyloid plaques build up, which are the building up of non-functioning tissue back to the atrophy of the neurons. So that becomes true of more and more neurons, and they kind of just build up in the aging brain. But there's something else that could have been put here as a sub-point that isn't there, and that is these beta amyloid plaques are like Pac-Man, the video game, where they just chew up whatever's in their path. Well, beta amyloid plaques chew up the tissue in the brain, so that after a while they have chewed up just about the whole brain. I mean, it takes a process. You don't get Alzheimer's 1 week and the next week you die. It's a process over time where this function, that function, the other function, this memory, the other memory, another memory, get constantly attacked by these beta amyloid plaques that take away the ability that was represented in that whatever it was that just got chewed up, which is why, and we're going to get to this also somewhere along the way here, but the last thing to go in an Alzheimer's patient is the how-to memory. Facts memory, episodic memory will both leave before the procedural memory leaves. So when the Alzheimer's patient ceases to be able, for example, to know how to tie their shoe, they're on their last few, I don't know, months or whatever it may be of life. Thirdly, it tells you that some of why older people get Alzheimer's is because it runs in their family. It's genetic. It's strongly heritable. But fourthly, another reason is lifestyle. So you did a bunch of wrong, unhealthy stuff that messed with your head, street language, but okay, it messed with your head. It fried your brain. It didn't allow your brain to remain healthy when you were younger, although the brain itself would have been healthy had you not drugged it and alcoholed it to death. Now you're further paying the price because maybe Alzheimer's will be the end result of all those bad decisions. Okay. So, it can only be diagnosed after death. So, how is it, therefore, that a person can be assumed to have Alzheimer's? Well, all that the clinician can do, the doctor can do, is go by the symptoms, but they don't really know for sure that they're right until an autopsy of that person's brain is done. Why? Because when they look at the brain under autopsy, they will be able to see, are there large gaping holes where nothing is there anymore. And that is obvious evidence that beta amyloid plaques ate it away. While alive, there are some kinds of tests, such as neurocognitive screening tests and prospective memory tests, where some level of valid conclusion can be drawn that this person probably, likely, is an Alzheimer's sufferer. So, treating it to the best delay, because you're not going to cure it, but you can ameliorate its process. You can slow down its process through something called Aricept, which is a cholinesterase inhibitor. Also through immunotherapy, behavioral therapies, the stuff that you see there, all of which is good, all of which is helpful, all of which has an effect to a greater or lesser degree, but they are definitely effective to slow down grandma and grandpa's dementia process. Measuring the intelligence of them is done by the Adult Intelligence Scale by Wechsler. Okay. Now, the Seattle longitudinal study supports once again, that use it or lose it is so true. So, it's the study indicates that there's a tremendous variation in older people in their level of intelligence. Those who are most intelligent are simply those who know more. That's all IQ is a measurement of how much one knows. So, as a result, the active older person who has continued to be a lifelong learner is going to be less likely to get Alzheimer's than the person not a lifelong learner, not a reader, not a studier, not an attender of challenging events that cause them to think. Maybe just doing challenging crossword puzzles. I mean, there are various ways to keep that brain sharp. Cognitive performance, therefore, can be improved for the reasons I just mentioned. Okay. Cognitive deterioration may be related to disuse. Same thing I just said, just another way of saying it. Use it or lose it. So, everyday problem solving, effectiveness remains stable until late adulthood, then declines. So, yeah, you can do that crossword puzzle or whatever other mentally challenging thing you do for the purpose of maintaining mental acuity. You can do that. It depends on all that other stuff, including genetics and lifestyle and all the stuff we just looked at, as to how old will be too old. I mean, some people are mentally sharp into their 90s. Some people are mentally sharp until the day they die. They didn't die because of Alzheimer's or any other dementia. They die for whatever other reason. So, okay. Important factors include emotional relevance of the problem. If it's important to grandma and grandpa, they are going to put more effort into solving whatever it is that needs their attention. If it means that I can help my grandchild work through this issue because I love them, that's emotional relevance that will cause them to really put their mind to the task. Think hard. How can I best advise this wonderful granddaughter of mine as to how to work through this issue? Also, whether the problem is personal or instrumental. So remember the ADL and the instrument. So problem solving that has to do with the bathing, dressing, grooming is important. If going to the store, to the doctor's office alone is important, then they're going to, if keeping my driver's license so that my kids don't take it away from me is important, then I'm going to do my best to keep my brain sharp so that I can hold on to my independence. Because let's face it, if you or I were not allowed to do our thing on a daily basis in an independent way, we would feel imprisoned. We would feel like our hands are tied. So grandma and grandpa would feel the same way. Like, I must be really, really old. I can't even drive anymore. So they're going to focus on that which is most important to them as the bottom line. Changes in information processing abilities. So some things decline mentally, some things improve mentally. What declines is the ability to learn new skills and to switch from one thing to another, focusing your attention first here, then there, then back to here, then back to there. That's hard. They are not as quick as they used to be in that regard, and that's because of what we learned a couple weeks ago about the difference between crystallized versus fluid memory. Crystallized is that's been with you all your life, the how-to stuff. But the facts stuff is less possible. The learning new skills stuff is less possible. So the improvements are with skills that depend on habits and knowledge. So habits and knowledge, I mean the how-to, the procedures, the crystallized stuff. Cognitive abilities and mortality. Some research has shown links between how long you live and how smart you are, basically, really. And some research has shown links between how long you live and how fast you can still react to something. Heads up, how fast can grandma turn around or granddad and catch that ball, or, that might not be the best example, but you get the drift. Okay. Memory changes in a late adulthood. Some things decline, some things stay the same, some things even get better. So what declines is memories of specific events. You remember that you got married, you remember that you had children, but there might be certain things surrounding that wedding, that reception, who was there, who said what to you, little nuances of the episode become a little fuzzy, but you do eventually forget that you got married. You do eventually forget who your children are in the last stages, but that is not immediate. What is more immediate is, yeah, I got married, yeah, you're my child, but what's your son's name again? I mean, maybe their own grandchild, they're a little bit, there's little things that go. Retaining, I've said this already, procedural, the how-tos get retained. Priming, you can get them to remember by priming, bringing up something that, oh yeah, that's right, and this also happened in connection with that. Just give them some hints. Ability to solve a problem or answer a question. So their ability to solve that problem or answer that question is helped through loved ones, friends, giving them some clues, some hints, some support, some guidance. This might even improve vocabulary and knowledge, semantic memories. Now, why is vocabulary possible to improve? It's that person who has become that lifelong learner. The more you read, the more you learn those big words. The more you are around smart people, the more you learn those big words. Facts. You are going to remember into your 90s, even though your memory is getting a little shaky, the date of your, major things that happened in the world. You're going to remember September 11th, 2001, for all kinds of reasons. But anyway, that's moving on because we've got just a few minutes left. Memory loss and brain functioning. So, the hippocampus, remember I've taught you all that to remember where memory goes is to think of the word camp. Memory camps out in the hippocampus. The episodes of your life, your wedding, the birth of your children, camps out in the hippocampus until those beta amyloid plaques even eat that up. Frontal lobes are where memory first lands and can be retrieved from there. The prefrontal cortex is in combination with the hippocampus where working memory is happening. You've had an experience. It leaves your short-term memory due to rehearsal. It goes to working memory because of having rehearsed it, but it will stay there as long as, or as short as many times as you retrieve it, as many times as you refer to it, as many times as you use it. So your name writing working memory didn't need to stay in working memory very long at all before it was sent to the cerebral cortex because of constant use. Your shoe tying memory, same thing. Your bike riding memory, same thing. Anything that gets used over and over and over goes to the cerebral cortex, to the various lobes of the brain where aspects of that memory need to go. So the shoe tying memory the parietal cerebral cortex is going to receive the movement of tying the strings. The visual cortex in the occipital lobe is going to receive what that looks like, what a correctly tied knot should look like. The temporal lobe is going to receive the information of remembering the voice of, let's pretend Grandma taught you to tie your shoes, so you're always going to remember Grandma, her voice, how she patiently told you, first you do this, and she congratulated you. You're going to remember that stuff. But this is telling you the bad news. It's telling you that in all three of these areas is where brain deterioration can happen and does happen in the process of dementia, memory loss. So encoding, storing, and pulling it back out again. So putting it in the alphabetized file modality. You've got these files laying on your file folders laying on your desk, and everything under A gets put there. Under B is the next folder. You get the point. And now you're going to store it in the file drawer. Storing it is storing it in that long-term memory place that I just was talking about, the cerebral cortex. And then if you've done an efficient storage, be it alphabetical, be it chronological, be it numerical, whatever way you have encoded your memory is the way that you do automatically store it that way in the files of the various lobes of the brain's cerebral cortex. If that is efficiently stored, you can then reach in that drawer. You can still pull out of the cerebral cortex various places to pull out that information of tying the shoe, writing the name, riding the bike. So with that said, I'm just going to move along because I basically explained what's there, and you can read it on your own. Older adults and meta-memory. Meta-memory is thinking about memory or having memory of memory. Yeah. So older adults, more than younger adults, report more perceived change in memory. Grandma might say, I'm having a senior moment. I'm aware that I'm forgetting, but give me a minute, I'll think of it. Less memory capacity. They don't feel that they can learn as much as they were able to learn is their feeling. Less control over their memory. Dang, I wish I could remember that, Another senior moment. So, can cognitive performance improve? So, deterioration is related to that use it or lose it, disuse, lack of use, keeping the mind plastic with training helps improve cognition performance, using memory tricks, techniques to help people remember. And so, this is something I'm going to actually talk about inclusive of next chapter where we're looking at the psychosocial, because I'm going to pull this into the ego integrity versus despair, whose virtue is wisdom if the person is on the ego integrity side and not the despair side. And I'm going to then talk about how that virtue of wisdom incorporates these aspects that we see here. So that's why I'm not going to say anything about it right now. See you good people on Monday. I'm sorry. Please, I hope you've all seen your email. But please, please know that starting tomorrow, I think it's starting tomorrow, but know that look in your email starting tomorrow at any rate after late morning goes by as to when the student evaluations will open up for you to go in and use or complete them, because this is the first semester they're trying this out, and I want to know, just like I wanted to know when we did it the way that us professors prefer. We would take the end of a class and walk out of the room and you guys would fill in bubbles and it would be done. But now, no, they want it done electronically. I get it. So please, please don't get lazy on me. And please do it. Because I need to still know how I'm doing, how I can improve, but I also hope I did at least one thing right. So, okay. See you guys on Monday.